I do receive research grant support from Alcon Laboratories, but has no relevance. And the question is the cataract surgery the new refractive surgery now that we have so many IOLs based on different optical principles helping us to do that? But I just want to say that refractive surgery, cataract refractive surgery, is a tool and it's not the end point. That refractive cataract surgery will allow you to produce a quality of vision with less dependence or no dependence on glasses, to change the quality of life and making the patient happier. So it's a very important step that we take this cataract or a clear lens surgery as a refractive surgery so that we can ultimately, finally, will be able to achieve that game. Other thing is that we have paid attention to the spherical defocus, ametropia 0.5, 0.75, and we have all the formulas dealing with, and we are very happy if we can achieve the targeted spherical equivalent. But we have not paid enough attention to the astigmatic defocus. Astigmatic defocus is more lethal to the quality of image than the spherical defocus. So I think time has come, now that we have mastered the spherical defocus, to pay attention to this, because it's really a, wait, it's not coming? Okay. It is really a problem, and we found in many years ago that 77% had more than 0.5 diopter of astigmatism in patients undergoing cataract surgery. So to me, toric eye or toricity and treating astigmatism is important, either as a monofocal component, as a multifocal component, whatever. Please address the toricity or astigmatism, and it's a necessity. It should be a norm. We should be asking questions why we are not putting toric component in this patient, rather than saying, can we put the toric lens? Because studies have shown that even treating 0.5, 0.75 is also worth the strain, provided you go through the protocol of precision, good equipments, taking time, understanding the patient, and so on, and there is using the right formula. The Barrett's True K and Barrett's toric calculators available free on these various websites really is a help. Now, customizing the presbyopic solution is something which is been there for many years. We have a cornea base, we have lens base, but I'm going to address more on the IOL base, clear or cataractless lens in the real life situations. And we have enjoyed the traditional multifocals of Atlisa, Technis, Restore Plus 3, 3.5, and many others like that. And they were quite okay, fairly flexibility, but not a quality. So there's a trade-off. Then in the evolution, Loads came, Symphony, Restore 2.5, Oculentis, and many, which concentrated on intermediate as well as the distance vision, and having understood that you produce a good quality but has to have a help of the reading glasses with extra lights. And then this, in the recent years, trifocals with Atlisa, Physiol, Panoptics, which addresses intermediate as well as to some extent reading, but the reading is never their strength. But all of these will have some halos and glare. All of these will have a low contrast sensitivity, reduced contrast sensitivity, and so on. For example, a traditional multifocal of Technis, Atlisa, Restore, all of these will have a 30-40 centimeter reading vision and an acceptable distance vision, but not very good intermediate visions. And they will have the negative dysphotopsias, glare, and also will need extra light and very little intermediate vision. The Loads, as I said, will concentrate more on the distance quality, is very good, and has some intermediate, useful intermediate vision for mobile computers at 50, 60 centimeters. And you can consider that in people who are ready to accept reading glasses. But the caution is that particularly these lenses, of all lenses, will need more light, because the light energy is more for distance and intermediate, so very little for reading. So For reading glasses, they really will need an extra light, and if the person's profession is to move to different offices like marketing, he can't create extra light everywhere. So this is a negative part of it, but otherwise that's good, and you can use the technology, and we have used it to our benefit of our patients, giving near and far for both, with combining traditional with LOADs, multifocal. But the trifocal has changed now, and with the help of trifocals, now we are able to address many patients who have motivation for not using glasses at all or very little, and we are able to do that at with quite ease with majority of the folks. And the optical principle is that if you have 40 centimeter, you will have to double the length, the double distance for intermediate. So these lenses, particularly the Zeiss and Physiol, have a excellent intermediate vision at 80 centimeter or around that time. And that works very well for people who are in the chef or a kitchen where they have to do a long distance, like cooking sort of thing. So these lenses are very good for those people who have an intermediate distance focus at a little further away. The newer lens like this, this is very good, Physiol and Zeiss, but the PanOptix, the newer entry to this, is something a little different, and it's not difficult to please ladies with any kind of multifocal, because their primary interest many times is thus this activity, and if they can do it, they're happy. It's the man and the younger ones who are very difficult to satisfy in multifocal practice in real life. But PanOptix with a shorter distance of intermediate is very good for people who are interested in a shorter distance and that kind of activity. So PanOptix, like the other trifocal, have a good comparable contrast sensitivity, but has a continuum or a seamless, excellent vision from near 30, 40 to 60, 70, or if you have the other one with 80 centimeter, there can be a little bit of a deep at around 50, 60 centimeter. But all of these lenses do great in terms of meeting the needs for greater spectacle independence. But if they have a really very fine vision or very demanding people, these are not the ones. There is a compromise, particularly for the reading visions. And also in the myopic condition, they will have a reduced vision, including PanOptix, including all these multifocal lenses. And they would have halos. Somehow with PanOptix it seems, although there is, I don't know there is any logical explanation, the halos appears to be a little less bothering. They are there, but they don't bother as much as they do with some other lenses. But whatever that is, this is the situation. But to really do well and to kind of be more successful and satisfying for the patients, you really need to pay attention to the precision and have the right equipments and treat the astigmatism as I said earlier, and be careful with the aberration profile, corneal profile, eye profile in general, OCTs. And OCT is something which not been used as much as it should be by cataract surgeons. We found in a study we published in American Journal of Ophthalmology that significant of patients who were seen by retinal people with normal ophthalmological fundus had a sufficient 18% in all abnormality, degrading the quality of the vision and making the patient unhappy. But enough chair time, counseling, and giving the negative aspects of all the lenses that you're going to use for refractive cataract surgery and customizing it for individual patients is something very useful. Have I any time? No?
Yes.
All right. This is a 43-year-old doctor with post-polar cataracts in both eyes, had a significant astigmatism in each eye, and he, like us, has a microscopic and dental chair, and he doesn't like wearing glasses. And we could handle him with the mix and match at that time, traditional versus LOAD. But this is something I would show last case, a a 52 years diabetic person, a very important socially and in charge of a good company, and always had the astigmatic glasses until now. And we suggested trifocal lens, and this is what she ended up, unaided with both eyes, with good intermediate and good thing. Can you hear this?
Yes.
There is an audio.
तो brightness में भी आपको comfortably दिख रहा है,
Volume.
Audio.
है ना? Because these are focus lights, like a headlight.
Increase the volume, please.
I can HZ वहाँ तक मैं आराम से read कर सकती हूँ.
And are you seeing any rings around the light?
ऐसे rings तो नहीं है, but हाँ, अगर like if I'm sitting in the car और सामने से वो आ रही है ना, तो थोड़ा सा लगता है yes.
How visually how disabling is it in terms of, if you look at the talk of the disablement, how disabling is it? Very disabling or just sort of?
Sort of.
Not really.
No.
You can drive with that.
I can. If you are going to ask me to drive in this, I can drive with
You can drive this.
Yes.
All right. All right.
अच्छा, हिंदी. चाहिए सफेद मोतियाँ करवाकर चश्मे के शीशे बदलने देने चाहिए. प्रतिवर्ष आंखों की परीक्षा को हाथ धोकर डालना चाहिए. पुरानी दवा को प्रयोग में नहीं लाना चाहिए. बच्चों को खेलने के लिए नोकदार खिलौना नहीं.
I think
Need
this
to
is
wear glass. You feel the need to wear glasses now for any fine work?
Not at all. Not at all.
Not at all.
Not at all.
That's
I can write very well. I can read very well. I have no problems.
I think the point is that with this cataract refractive surgery, we are able to make patients more happier than earlier, but there will be patients where we have to avoid putting these multifocal lenses if their ocular profile is not good, their corneal profile, their hobbies and their demands are such that you need to be very careful.